हाइपरटेंशन डे, आप ये देखिए कि इस बीमारी की इतनी अहमियत है कि इंटरनेशनली इसके ऊपर एक दिन मुकर्रर किया हुआ है। ऑब्वियसली कुछ ना कुछ तो है, ओलंपिक्स डे है, हमारी इंडिपेंडेंस डे है, सो एवरीथिंग इज अ डे। सो वर्ल्ड हाइपरटेंशन डे, देयर इज अ रीजन फॉर दैट, एंड फॉर दैट रीजन we have one of the most eloquent speakers, a distinguished academician, and a wonderful person, Dr. P.N. Renjen, who's senior consultant in neurology at the Indraprastha Apollo Hospital, is a graduate from India, but a postgraduate from England and Glasgow, and is a great social activist in helping how people should stay away from getting a brain stroke, जो कि as good as a heart stroke होता है. So welcome, Dr. P.N. Renjen, sir. A pleasure to have you once again with us. And on this very important issue of World Hypertension Day and how is it important for the brain. Welcome, sir. You're muted, sir. Sir, you're muted. Can't hear you, sir.
Namaste. Am I all right now? Audible?
Yes, sir, please.
Namaste, everybody. Thank you, Dr. Grewal, for asking me to be amongst you again. And the series of programs which we have done with Dr. Grewal, not that we have been there, but we have really enjoyed doing them. Why I say that we've enjoyed doing them is because the interaction is so good that I also feel happy, as Dr. Grewal feels, that I'm able to spread the message of stroke to the rural as well as the urban population, that this fourth largest killer can be prevented if educated, treated in time. Thanks, Dr. Agarwal, once again. Tomorrow is the World Hypertension Day, and I'm sure all of us who are coming today do appreciate that hypertension is a silent risk factor for stroke, is a silent risk factor for heart disease, is a silent risk factor for kidney disease, and is a silent risk factor for peripheral arterial disease. Now, what is a stroke? So my first 2-3 slides may be a repetition, but I'm sure always repetition also helps. A stroke, you all know, occurs when the blood flow to part of the brain is blocked or reduced, depriving the brain tissue of oxygen and nutrients. There are two types of strokes. One are called the ischemic strokes, and the other one are called the hemorrhagic stroke. The ischemic stroke occurs because of a blockage of vessels, and hemorrhagic stroke occurs because of the bleeding inside the brain. And the symptoms and signs of these two strokes are really the same. Again, a slide which you might be all used to, that there are modifiable risk factors which can be controlled and treated, and there are non-modifiable risk factors about which you and I can do nothing about. So we should know the modifiable risk factor. Now, if you see this chart, hypertension or high blood pressure is the first and the largest risk factor. 2 comes diabetes, risk of blood vessel damage. Hypertension, cholesterol, contributes to atherosclerosis. Smoking damages blood vessels. obesity, especially central obesity, abdominal fat, physical inactivity, obesity, hypertension, diabetes, unhealthy diet, high in salt, sugar, and saturated fatty acid. One new modifiable risk factor I would add for your information is what is called obstructive sleep apnea. We have been working on it, and this is also a modifiable risk factors of alcohol, of stroke. Excessive alcohol intake, stroke after the age of 65 years, atrial fibrillation, which is nothing but the irregular heartbeat, which can cause clots, drug abuse, stress and depression, poor sleep or sleep apnea, which I just talked about. The non modifiable risk factors, for which you and I can do nothing much about, is age, sex, family history, ethnicity, and previous stroke or TIAs, strong predictor for future strokes. Now, let us come to the topic for today, hypertension as a modifiable risk factor. Hypertension is the number one risk factor for stroke. It damages blood vessels, making them more likely to block or rupture. High blood pressure can lead to blood clots, aneurysms, and narrowing of the arteries. Some key data can be tailored according to your region. People with hypertension are 4 into more likely to have a stroke. The patients with hypertension are at 40% more higher chances of having a stroke. About 1 in 3 adults have high blood pressure when they come to us with a stroke. Who is at risk? Age 65, 45 and above, family history, obesity, sedentary lifestyle, high salt intake, smoking, excessive alcohol, and lastly and importantly is stress. How to prevent hypertension and stroke? The most important thing is lifestyle changes. Whenever I talk about lifestyle changes, people always ask me in a meeting that this is a very vague term, and everybody talks about a modulation of lifestyle challenge. So, what is it? What should we actually do to modulate or to change a lifestyle? Most important is eat a balanced diet. White, which is less in fats, not that high carbohydrate diet, diet which contains vitamin B12, diet which contains antioxidants, exercise regularly, limit salt and alcohol, quit smoking, and importantly, as I always say, manage stress. Now, we did a small, just a study, it wasn't a study really, of about 1,000 patients, and we put them into 3 or 4 categories. Out of this, how many people know that their hypertension was less? People who knew but did not take the treatment were more because they were not ready to accept the fact that they have hypertension. And people who were just not aware. So once you are aware of the fact that you have an hypertension, it is your bound duty to take measures to keep it under control. Sorry. Okay. So then what do you do actually? You can't keep on having tests every now and then. But I would certainly recommend encourage regular screening, even if you don't have symptoms. Just saying that I am healthy, yes, you're healthy is a very good thing. But there's always better. And to encourage people to have screening. Community programs and clinics can help. Public awareness among families and friends. The question which is usually asked, what is normal BP? Is it hypotension? I have got low blood pressure. Patient himself presumes that I have got low blood pressure. Because of that, he stops the treatment. When the blood pressure goes up, he takes amlodipine. The blood pressure comes down. He stops the treatment. Recently, the American Cardiology and Indian Cardiology Association, the normal blood pressure is 120 to 80, and anything, I will correct this, about 135 is a blood pressure. So, what you need to do is to monitor your blood pressure regularly, avoid fluctuations in blood pressure, don't intermittently stop drugs, take your medicines regularly, and don't be too much bothered that my blood pressure is 120 by 80. It is low blood pressure. Before we started off, I heard there is nothing known as low blood pressure. And I totally agree on that. If you have no signs and symptoms, there is no reason why you should bother. So, most importantly is to accept that fact that you have blood pressure, accept that fact that you require treatment. Even if you don't require treatment, accept the fact that you can manage your blood pressure with diet and physical exercise. If it is still not controlled, then obviously you need treatment for the same. What are the warning signs of a stroke, which you all know, which I've been talking about in and out? Fast, face dropping, arm weakness, speech difficulty, time to call emergency. So if you have your face becoming cockeyed or tilted, your arm getting down, you have a problem with your speech which is slurred, time to call emergency services. I can tell you, as a neurologist, it is not very easy that when the patient has very early signs of stroke, to tell him to get admitted to the hospital and get his treatment. 4 days back only, I saw a patient, very minimal signs of the left-sided stroke. When I did an MRI, there was an infarct already there. So please don't neglect the warning signs of stroke. Act fast and as early as you can. What to do? Medical management, as I said, regular checkups. You might as well keep an instrument in house, check your BP, and regularly seeing your doctor and taking the regular prescribed medicine. Public call to action. Know your numbers. Encourage loved ones to be screened. Share the information and support local health program. It is excellent. Sorry, it is excellent that the program like which Dr. Grewal is doing, it is really a support program. It's to support your own self, support your family, support your neighbors. And what I've been doing in Apollo for the rural India also is to make them aware that there is something called stroke. So, ladies and gentlemen, what are the takeaways from what I have said for the last 25, 30 minutes. Hypertension is common, dangerous, and preventable. I'm not scaring you, but I'm trying to use these strong words so that you appreciate how important it is to manage stroke, hypertension. Stroke is often preventable, and controlling blood pressure is the most important thing. Act early and live longer. Thank you very much for the patient hearing.
Thank you, Dr. Ranjan. That was, I think, loud bells ringing, loud bells ringing. See, on the day of Pranita, can you add me also in the uh, pin, please?
Yes, sir, I've done it.
अच्छा अभी आ नहीं रहा मेरा.
Let me try to do it again. Just a second.
Okay. So what first question, of course, you must be already reading. 70-year-old person, what would you suggest him to have a blood pressure reading that can prevent a stroke? So I remember, everybody, please carefully listen. मैंने ये नहीं पूछा मेरा blood pressure कितना होना चाहिए. My question to the expert is, what is a safe range of blood pressure for a 70-year-old person? That's the question.
The
Dr.
answer
Ranjan.
is first, avoid as much as you can fluctuations in blood pressure. Even if you are 70, I would like your blood pressure to be 120 to 130 by 80. That is not at all low blood pressure for you. So make sure that you avoid fluctuations of blood pressure which are more harmful. And number two, more the fluctuation, more the atherosclerotic damage. So this is the worst thing to do, that you have 140 by 100, you take amlodipine 5 milligram, after 2 days it is 120 or 130 by 80, you stop the medicine, and then when you go and see your physician, you tell him, I stopped the medicine because I thought my blood pressure is low. Please don't do that.
I think everybody will have a different blood pressure depending upon that individual's risk factors. So please don't say मेरा इतना है, उसका उतना है. Everybody is going to be having different. The doctor will decide कि आपका blood pressure आपके लिए कितना ठीक है. That is stage first point. Because everybody is सुबह सुबह बीपी, मेरा बीपी इतना हो गया, मेरा बीपी इतना हो गया. You must know what is your range. Now, there are a number of questions coming. First and foremost, I'll just, as most of the people attending here are beyond 70, mixed doctors and non-doctors. On World Hypertension Day, if a 70-year-old person is not on medication, Dr. Renjen, he is not on any medication for high blood pressure, is he still at risk to get a stroke?
Absolutely, he is.
Yes.
What I would do really is that if you come to me for the first time,
Ji.
I would look at your eyes. I mean, I want to know. The people are usually of the opinion, my blood pressure is normal and I had a stroke.
That's right. That's right.
Must be having a blood pressure for some period of time, which obviously you didn't accept or you didn't do treatment. So please do three things. Look at your eye for any hypertensive retinopathy. Look at your kidney and look at your carotid arteries. Carotid arteries are two arteries. If you Just see what I'm showing you. These are the two arteries which supply the brain, which is present right in the neck. In fact, you can feel the artery. You just put your two fingers there, you will feel the pulsations of the artery. You see the beautiful pulsation there. So if you do this much, and if your blood pressure is 140 by 80, it's not normal for you. You will
It
require to
is,
be treated.
even if it is 140/80.
Yes.
Now here comes the warning. So the decision के आपका इलाज होना चाहिए is not based on your reading, but what Dr. Renjen is warning you कि अगर आपकी carotid arteries में कुछ बंद हो गई है तो आपका 140/80 भी आपके लिए ज्यादा है। इसीलिए उन्होंने क्या कहा, कई एल्डर्स आएंगे, मेरा ब्लड प्रेशर तो नॉर्मल आता था फिर भी मुझे स्ट्रोक आ गया। दिस इज द बिगेस्ट मैसेज फॉर ऑल एल्डर्स टुडे। Please, you are at risk to get a stroke. Find out your risk. Get the retina, get the kidney, and get your carotid arteries tested before you be complacent कि मेरा ब्लड प्रेशर 140/90 है, डॉक्टर कह रहा ठीक है। You are not out of risk. So, Dr. Ranjan, what you're suggesting to my colleagues is, irrespective of your age, irrespective of your blood pressure reading, you need to get 3 examinations to find out your risk factors. Dr. Ranjan, my request to you, please repeat the 3 examinations to find out my risk.
Well, one more thing, as what Dr. Grewal said, by adding on to these three things, to some extent, you will also know that how long you have been hypertensive in a way. What I mean to say is, go to an ophthalmologist, let him look at your retina, let him look at your arteries and veins in the eye. Is there any nipping in the arteries or vein suggestive of a diabetic retina, sorry, a hypertensive retinopathy? Two, very simple. Just get a serum creatinine or just get a urinary examination.
Urine.
By chance in the urinary examination, you find there's albumin. Definitely it means that you have a kidney disease. And third, and the most important is, just go across to any place and tell them to see your carotid vessels. Because why I insist again on carotid vessels is that 60 to 70% of strokes come from the carotid vessels. And if you have a stenosis in the carotid artery, it's a preventable cause of stroke.
Prevent.
So how important you can realize it is. You know, these are called asymptomatic carotid stenosis. When they become symptomatic, then you already had a stroke. But if they're
तो आज जो
asymptomatic,
भी लाई हूँ मैं
sorry,
Sorry?
Nothing,
No,
sir.
please carry on.
so if you have an
Sorry?
asymptomatic, you may not do anything to the artery in the form of a PTCA. But again, I would stress, you may get such minor symptoms of TIA, which you would neglect, would be coming from the carotid artery. So this is the basic. One needs to be more and more careful as the age advances.
So I think what is important is, ब्लड प्रेशर को हल्के में मत लीजिएगा और ये मत सोचिए मेरा इतना ब्लड प्रेशर है, बिकॉज अगर स्ट्रोक से बचना है, टुडे ऑन वर्ल्ड हाइपरटेंशन डे वी वांट टू प्रोटेक्ट यू फ्रॉम गेटिंग ए स्ट्रोक, क्योंकि इट इज पॉसिबल टू प्रोटेक्ट यू एंड दैट इज इंपॉर्टेंट। बत्रा जी, आई जस्ट कम टू यू। मैं बार बार मैं वार्निंग दे रहा हूं सबको कि प्लीज डोंट से मेरा ब्लड प्रेशर ठीक है, अनलेस एंड अनटिल, डोंट से, ये तो कहना ही नहीं आपने। आपने कहना है मैंने अपने आप का चेक कराया है और मेरा स्ट्रोक होने के रिस्क कम है। ब्लड प्रेशर का शब्द बोलना भूल जाइए, आप चारों को लीजिए। जो डॉक्टर रंजन ने एल्ब्यूमिन, पेशाब में एल्ब्यूमिन बोला है, वो डॉक्टर रंजन मैं सबके लिए फिर पूछना चाह रहा हूं। अगर मेरा ब्लड प्रेशर 145/85 या 90 है, हाँ, अगर ब्लड प्रेशर नॉर्मल 145 या 150/90 भी है और मैं दवाई नहीं लेता, आपके पेशाब में एल्ब्यूमिन जो प्रोटीन है वो फिर भी पाया जा सकता है। और अगर वो पाया जाए, दैट मीन्स वो ब्लड प्रेशर जो 140/90 है आपके लिए हाई है। सो प्लीज अंडरस्टैंड, बीपी इज वन aspect of prevention of stroke. It is the highest. But to find out whether I am at risk or not, blood pressure normal is not the way. You have to see the retina, आंख के अंदर, पुतली के अंदर, नॉट विजन। विजन चेक नहीं, रेटिना चेक। कैरोटिड्स का डॉपलर होता है एंड यूरिन का एल्बुमिन होता है। सो टुडे प्लीज टेक ए लेसन that unless and until you get these three tests done, you are not safe from getting a stroke. और ब्लड प्रेशर का इलाज हार्ट अटैक, स्ट्रोक एंड हार्ट फेलियर, ये तीन से बचने के लिए इलाज होता है। और अगर आपका असेसमेंट है कि हार्ट फेलियर, इकोकार्डियोग्राफी और एल्ब्यूमिन पॉजिटिव है, तो आपका 130